Let's get back to this. Malawi has delayed the reopening of schools in two main centers due to the outbreak of cholera in the country. Schools were due to reopen next week Tuesday, but they stay closed in Blantyre and Lilongwe to prevent further infections and deaths. Almost 600 people have died in the latest outbreak. We're now joined by Khumbize Chiponda, Malawi's Health and Population Minister. Ma'am, thank you very much for availing yourself this afternoon. Please help us understand, is it only Lilongwe and Blantyre that is affected, or is it a countrywide problem?
No, thank you so much for having me. No, in terms of Lilongwe and Blantyre, actually the hotspots where we are having more cases, and also where we are having even the number of people who have died from cholera. The highest numbers they are from Lilongwe and Blantyre as a districts. But in general, since the first cause of cholera, which was last year, in almost all the districts of Malawi, they have been affected. Of course, some of the districts would have one or two patients, and maybe in some of the districts we don't have like an active case as of now. But for Blantyre and Lilongwe, which are our major cities, those are the hotspots where we're having more cases, active cases, but also we are having more people who have been admitted in different treatment units, and as well as the highest number of people who have succumbed to the cholera outbreak.
What is driving the surge of infections in these hotspots of Lilongwe and Blantyre? What are some of the risk factors?
I think, cholera, it's all about sanitation and hygiene. So you find that the hotspots in both cities, like where you have the high density communities. It means issues of water. Some of them, they don't have reliable sources of good, self-potable water. So that is one of the issues which is affecting them. And of course, also, they have the mobile markets as well, which get congested with people, things like those. And also some of these areas, these places where people, they've built houses not according to the way it's supposed to be done, not following maybe city planning procedures. So these are the areas which really we are having a big, huge problem.
Ma'am, it sounds by and large that this also boils down to service delivery issues. Is that safe to say? And if so, what is the government of the country thinking about in terms of ways of improving the quality of life to people, getting people consistent, reliable water supply, amongst others?
Yes, indeed. You can say that maybe the Department of Services, we need to do something about it. As government, we have now that it is the presidential task force which is handling the cholera issue. The president directed that we take over the cholera issue because he was looking at this issue being multi-sectoral. It is not just about the Ministry of Health issues, because the Ministry of Health, of course, you concentrate on case management, and of course, we also concentrate on preventive measures, whereby we have made available the cholera vaccine, but also teaching the general public on the preventive measures or containment measures of cholera. But it goes beyond that. We are talking of issues of water, and now we have the Honorable the Ministry of Water and Sanitation. They're part of the presidential task force to make sure how do we assist these people. Like I said, some of the areas, they might not have a reliable source of water. So we are talking to the water boards as well, and we are very thankful to them that they have been very, very responsive. They've opened some of the kiosks, which were closed because, people, they were still owing money to the water boards. But we said, no, we have a crisis. We need to address them. Let's give them, agree on payment terms, a few months where they can sort out their previous bills, but they reopen the water. So they have done that. Some areas where they did not even have any connection, they have extended the pipes to make sure that all the communities, they have at least a source of good water. But we also have local government involved because we are talking of cities. So we have city councils as well as the district councils who also have to do their part. And we commend them because they have also come up with their own bylaws. As a city, as a council, they have come up with their own bylaws to make sure that we do community sensitization, but also make the public aware on how they can prevent getting cholera. Because cholera is one of the diseases which is preventable. We just need the people to know the hygiene practices and also sanitation practices as well.
Ma'am, how do you respond to people who have put the blame squarely at the door of not only your department but the government at large, saying that you are more reactionary as this matter has been on record since last year already?
No, not really. I don't think that is the case. We have to do our part. Like I said, we had the first case that was last year. That was 20th of February. But that time, the places which were affected, they were the ones which were hit by the cyclones. You know, we had to battle with at least 3 cyclones. And in the areas which were affected, because the sanitation and the hygiene facilities, most of them, they were damaged because of the cyclones, because of the water. So that is where the cholera started. And then it spread along the lake shore. So we dealt with that. But we also were communicating on a weekly basis. And then when things, they were getting worse, we were communicating on a daily basis, telling the people what to do. And indeed, like I said before, we went even further. With the help of World Health Organization, we got the vaccines for the people just to make sure that the people are protected. But like I said, we had to make a decision of closing school because of, in the last 7 days, last week, we had a huge surge in the numbers, especially of the people who died in the 2 cities, and also the number of, active cases. It could be because, it was festival period. A festival period, people, they move around a lot. They're in a merry mood. So they might not have been keen on some of the hygiene issues which we are talking about, or which we have to put in place. So the closure of schools was basically to say, we also need to assess the same facilities in our schools, especially in the cities, to make sure that when our kids go back there, they should have good water, but also put in place things like we have to give them chlorine to make sure that, they clean the hygiene facilities like the toilets, things like those, but also to talk to the caregivers, the teachers, on what to do if a child is sick. So things like those which we need to put in place. So we are not being reactive, but we are making sure that we put all the things in place just to make sure that the students as well as the teachers and the caregivers, when they get back to school in these 2 cities, they should be protected.
Is it too early to ask, ma'am, when you anticipate schools will be open?
We have asked for 2 weeks, 10 working days, but with the weekend that it's almost 2 weeks. So we have asked for the 2 weeks. In the meantime, teams are already on the ground, and these teams comprises of officials from the Ministry of Health, from the Environmental Department, as well as education and the local councils who are working together to visit each and every school, the institutions, the learning institutions, primary and secondary school, just to check on what is actually on the ground so that we can address these issues quickly. We don't want to go beyond 2 weeks, knowing very well that, education, they go by timetable. They have things already set out that they need to do ABCD. The students have to learn this by this week. So they have timelines. We need to stick to that, knowing very well that, also education is very, very important. So we would not want to keep the kids out of school for much longer.
Reports on the Nation website indicate that there were a number of students that were stranded as well when the announcement was made, because they were on their way to school but had to turn back, and before their parents even knew, they just saw pictures of their children circulating. And so has every child made it safely back home?
Yes, so far I've not had any reports of having our students being stranded. No, I haven't had it. So we are sure that most of them, they have gone back, and maybe some of them, they also maybe have relatives in the two towns. But we have not received any news of a student being really stranded, that they need help. If they went to school, we have very capable mistresses and headmasters who would really take care of the children. Otherwise, the Ministry of Education, they could have alerted us, but we have not heard anything.
Malawi's Health and Population Minister, Ms. Khumbize Chiponda. Thank you.